How common is this epistaxis?
That 60% of the population once in a lifetime they do face the situation in which their nose bleeds. So this is a combination of two Greek alphabets, that is epi and staxis. So epi means something from the top and staxis means to pour.
Adults versus children, is there any difference in epistaxis?
Yeah, it's quite lot differences there, because nose, it can be hypertension, it can be something related to the liver, it can be post-operative, lot of conditions are there in the adults.
Thought that most of these nosebleeds are harmless.
Told you, if it is very frequent, if it is very heavy, if it is not responding to the home remedies, we have to take care of, we have to look for the other things like blood cancers also.
That brings us to the last question for the podcast today. What is the one advice or maybe one or two advices you would like to give to the people? Namaste everyone. Welcome to yet another episode of podcast with me, Dr. Amitabh Kulkarni. This podcast we try to select a common topic, try to understand, try to simplify with an expert's opinion. Today's topic is something which is very commonly misunderstood. Everyone knows, but it is quite misunderstood. Epistaxis, or in common man's language it's called as nosebleed. Many a times we blame it to weather. Many a times we blame it to dry nose. How much of this is fact and how much of this is like actual truth or myth? To help this understand, I'm very happy I'm joined by Dr. Sanjay, who is an experienced ENT surgeon and who has seen numerous cases of nosebleeds. Today he is going to explain to us what are the common reasons when we should be worrying about nosebleed and when we should not be worrying about it. Thank you, Dr. Sanjay, for accepting our invitation. In fact, welcome back to one more episode with you. I am very happy. Dr. Sanjay, for viewers' understanding, can you just tell us something about your background?
Thank you, Dr. Amitabh. Thank you for giving me another opportunity to share my knowledge, my information regarding epistaxis. I'm Dr. Sanjay Kewalramani. I'm working in UAE since past 25 years in both private and public healthcare sectors. So today we'll be discussing about epistaxis. So as the word itself means epistaxis. So this is a combination of two Greek alphabets, that is epi and staxis. So epi means something from the top and staxis means to pour. So I think nose being the organ which is there on the top of the body, anything pouring out from the nose was coined as epistaxis.
Okay.
So now in the medical terminology, any bleeding from the nose, it is termed as epistaxis or nosebleed.
So thank you, Dr. Sanjay. How common is this epistaxis?
It is quite common, Dr. Amitabh, especially with the present weather situation when temperatures are soaring to 41 degrees. So I have seen sudden surge in the patients who are coming with the nosebleeds. But overall, common studies which were done regarding epistaxis, they suggest that 60% of the population once in a lifetime, they do face the situation in which their nose bleeds. Out of this 60%, only 6% population, they need medical attention. Means most of the majority of the cases, it settles on its own. And out of this, the male, they have a more chances of having epistaxis, that is about 55 to 60% of males as compared to 40% of females suffer the episode of epistaxis once in their lifetime.
Yeah, so it's quite common that way.
Yes, it's quite common, and it's quite common, you should say that.
So then adults versus children, is there any difference in epistaxis?
Yeah, it's quite lot differences there, because nose being the breathing organ of the body, it has a very rich vascular supply. The role of the vessels is that whatever air that you breathe in, it should be moist air, and the temperature of the air that you breathe in should be that of the body temperature. So that outside, even if it is very hot or very cold, whatever air that you breathe in, it goes into the body, into the normal body temperature. And that is a function of these blood vessels which are located in the nose. These blood vessels, they are very thin and they are covered with a very thin layer. I should say they are very exposed to the external environmental changes. So any external change in the environment, they cause bleeding from the nose. Especially in the pediatric age group, if the kids they catch cold, which is very common, or habit of nose picking, which is again very common. These two are the conditions which are commonly seen in the pediatric age group, which can cause epistaxis. In adults, there are a lot of other causes. It can be because of course, nose picking is one of the common cause. Then it can be underlying medical conditions. It can be hypertension. It can be something related to the liver. It can be post-operative. Lot of conditions are there in the adults. But in pediatric mainly, I should say either it is because of the nose picking habit or it is because of any allergic conditions of the nose, which can cause a bleeding in the pediatric age group.
So causes are different in adults versus children, but it is more commonly seen in children, you mean to say?
Yeah, it is sometimes commonly seen in children, but depends on the weather conditions, the allergies prevalent in that particular area. If the weather is very hot and dry, of course, chances are more, because hot and dry weather again cause dryness of the nasal mucosa. And if the child is not drinking proper amount of fluids, if the child is dehydrated, again he is more prone to bleeding. And again, because of the common allergies which are prevalent, especially in UAE, kids they have allergic issues of allergic rhinitis, again they are more prone to have epistaxis. In adults, of course, yes, people who are working in the outdoors, people who are not taking adequate fluids and the temperature is very high can cause dehydration, can cause bleeding.
Yeah, so that was very simple explanation. Now, commonly it is thought that most of these nosebleeds are harmless, or we shouldn't be worrying too much about it. I am sure that's not the case. Dr. Sanjay, in your experience, what is the scenario? Is it like always harmless, or what are the signs, or what are the symptoms which you should be looking for, or someone who has a nosebleed, he should be paying attention to, so that it's not just a harmless one and he should immediately visit the expert for that.
So as I explained, Dr. Amitabh, 6% of the population, they may need a medical intervention for management of the epistaxis. So I should say that most of the bleeding episodes, they subside on their own, taking some common home remedies. Like if the nose starts to bleed, you should not panic. Just sit straight with the thumb and the index finger, just pinch your nostril, open your mouth and breathe. So body has a tendency to stop the bleeding on its own. We do have some factors in the body, we call them as a clotting factors. So they act once the bleeding starts and they help us in controlling the bleeding. But in situations in which the bleeding is very frequent, it is not stopping with the regular home remedies, or it is causing severe weakness or some other symptoms, then you should consult the physician so as to find out the exact cause and then to be treated accordingly. That means if it is not stopping on its own, as I told you, with the precautions to be taken at home, something underlying is there that is to be taken care of. But I should say that 80% of the cases, they do stop on their own, in which you don't need any medical intervention.
Thank you, Dr. Sanjay. So, see, we are living in UAE, which is like a hot belt, dry belt. So does the weather or dry or hot belt, all these things, do they really matter, or do they trigger such nosebleeds?
Yes, Dr. Amitabh. Because of the dry weather, as I told you, there is dehydration, taking inadequate amount of fluids, leading to dehydration in the body. And as the nose being the part of the body which is directly exposed to the external weather changes, any increased heat can cause dryness of the nose and it can predispose or it can trigger the bleeding. So usually if a person is working out in the sun, so these are the people who are very prone for these kind of bleedings, and if a person is not taking adequate fluids, again he is prone to have these kind of bleedings.
Yeah, so the hot weather or dry belt or dry area, you think it's supposed to be a trigger for such epistaxis?
Yes, of course. These are the triggers for the bleeding to start.
So people living in this area, they should be more careful about this nosebleed. They should be knowing more about this.
Yes, basically to take the common precautions when you are out in the heat, to have adequate amount of fluids. These are the two things that can be done at your end and that can prevent this epistaxis.
Dr. Sanjay, one more term which we commonly hear is like anterior versus posterior epistaxis. anterior versus posterior nosebleed. Now this probably is more from the doctor's point of view, but why it is important and why even people should be aware about this types of bleed so that attention is sought as early as possible.
So, Dr. Amitabh, yes, there are two terms which we commonly use. These are the medical terminologies. That is the anterior bleed and the posterior bleed. So, as the term itself reflects, anterior means which is in the front. So, the anterior bleed basically it is seen from the nose. The nose, it is having a septum which divides nose into two, into right and the left half cavities. The septum anteriorly has an area, we call it as a Little's area. In the Little's area, there are about 7 blood vessels. It's a confluence of 7 blood vessels that come and meet in this Little's area. And then at the back of the nose, we call it as a posterior plexus. There also about 5 to 7 vessels they come and they meet together. The anterior epistaxis, which is caused because of the issues of the Little's area or the area, as I told you, about 7 blood vessels they come and meet. So these are basically a safe kind of bleeds. So you don't have to worry much about it because it can be seen very easily anteriorly and it can be managed very well by taking care, by doing the home remedies, as I told you, by pinching the nostril. But the posterior bleed, they are very difficult to visualize. And the common cause of the posterior bleed is some underlying systemic disorder, like it can be diabetes, it can be blood pressure, it can be something related to the liver, or it can be something related to the vasculitis, in which the bleeding part of the body doesn't work very well and it gives rise to bleeding from the posterior aspect of the nose that we call as the posterior epistaxis. In posterior epistaxis, I should say that 99% of the posterior epistaxis, the medical intervention is required, in which we have to pack the nose, we have to do some put the balloon in the nose, or we have to take the patient to the operation theatre to clog those blood vessels so as to control the bleeding. So anterior bleed is a safe bleed, I should say. The posterior bleed, sometimes they become very difficult to manage and then we have to intervene surgically for them.
So in simple terms, what people should understand is anterior bleed is probably the harmless one, which most of the people presume it is anterior bleed, but the posterior bleed is something which probably has something more underlying disease, and the attention should be sought by the experts as early as possible. But from layman's point of view, doctor, how will a general person understand whether it is a anterior bleed or a posterior bleed?
The posterior bleed, as I told you, because it is at the posterior part of the nose, so most of the patients, when they bleed, they ingest the blood. Once they ingest the blood, it irritates the gastric mucosa and then they vomit out that blood. Okay. So any person who has a bleed and he's vomiting out, that means it is a posterior epistaxis. The anterior epistaxis, usually the blood flows anteriorly and it doesn't goes back. So that way you can differentiate whether it is a posterior bleed or it's an anterior bleed.
So if something simple language, if it is just the simple a small nose bleed, we can presume it can be anterior bleed. But if it is associated with some extra symptoms like vomiting of blood and all, maybe there is something happening posteriorly and it's something may not be just the harmless bleeding.
Correct.
Yeah, thank you Dr. Sanjay for this simple explanation. At home, suppose if someone gets a nosebleed or is walking on the road in this hot climate, what first aid he can do either at home or when he is walking around?
At home or walking around, at the most, if he is exposed to the exterior sun, better to go and sit in a shaded place.
Okay.
Just to sit straight with the finger and the thumb, just to pinch the nostril above the ala, somewhere here, and just to open the mouth and breathe. Okay. Within 5 to 6 minutes, the bleeding stops on its own.
Yeah.
And then there must be some clots in the nose, which can be taken care of by using some saline nasal sprays. And the other thing is that they should not blow the nose forcefully. Blowing the nose forcefully after the bleeding stops can again aggravate the situation and it can again start the bleeding. Yeah. So just sitting straight, opening the mouth, breathing from the mouth, pinching the nostril, within 5 to 6 minutes, the bleeding should stop if it is an anterior and a normal bleed.
So this was quite simple to understand either. So then what should not be done if something like this happened? What mistakes you have seen patient doing which can actually worsen the bleeding?
Now the situation sometimes we come across is a person is having an anterior bleed. So instead of sitting straight, the person lies down.
Okay.
So the blood, instead of coming, the flow coming anteriorly, this blood trickles
Goes
back
back,
into
yeah.
the throat and it goes into the stomach. And going into the stomach, as I told you, the stomach mucosa, it gets irritated, and then it can lead to vomiting of blood, and it can lead to some dizziness. So basically, any bleeding, as I told you, just sit straight. So you should not lie down if you start to bleed. And at the most you can do is sitting straight, pinching the nostril, or you can have some ice packs in a bag, in a polythene, and just do some cold fermentation around the nose.
Yeah.
That will again cause constriction of the blood vessels, and it can help you in stopping the bleed.
Dr. Sanjay, frequently we have seen someone who is on some certain medicines like blood thinner, like aspirin or clopidogrel, or someone who has hypertension. They also can have nosebleed. So is there any specific population amongst these people who are at a higher risk for nosebleed, or everyone who is on these medicines or who has hypertension can get nosebleed some or the other time?
Basically, Epistaxis, it is having a bimodal distribution. That means it can be seen at very early
Early
ages
age
also, and it can be seen at extreme of ages also, when a lot of people have a lot of comorbid situations also. A lot of studies have been done regarding the association of epistaxis and hypertension, but till now it hasn't been proved that hypertension can lead to epistaxis.
Okay.
It has been proved that a person who is hypertensive, if he has the epistaxis, so managing epistaxis in these patients sometimes becomes very difficult, because the blood pressure, a person having blood pressure for a long number of years can lead to narrowing of the blood vessels. So as I told you, the epistaxis is because of the breaking of the blood vessels in the nose. So because of the long-standing history of hypertension, they can have narrowing of the blood vessels. In that situation, the normal, as I told you, pinching the nostril or ice cold fermentation may not stop the bleeding. So in these situations, a hypertensive patient, even if having the anterior bleed, may need medical intervention like doing the silver nitrate cautery or putting some bioabsorbable material in the nose to stop the bleeding. So hypertension per se doesn't cause epistaxis, but to manage epistaxis in a hypertensive patient, sometimes until unless pressure is not under control, becomes very difficult to stop the bleed.
Yeah, so this is a very important message that hypertension directly may not cause, but if your blood pressure is high and if there is any other trigger for epistaxis, sometimes the bleeding may be more than what is expected.
Okay.
Similar thing must be happening with the blood thinners.
Yeah, of course, with the blood thinners, if he's regularly taking it, so you have to manage your dosage according to the regular doing the INRs, and as if like any part of the body can bleed if there is some discrepancy in the INR, even the nose can also bleed.
Yeah.
So in this situation, you have to manage your bleeding time, clotting time, and INRs, and then that can help you in controlling the bleeding also.
That brings us to the next question, a very important question. If someone has a nosebleed epistaxis, should he always come to a ENT specialist, or something can be done at the GP level or in emergency room, so that at least the immediate avoidable consequences can be dealt with?
So as I told you, most of the cases, if there is a simple anterior bleed, there's no need of going to an ENT specialist. Even in the AR, the GP specialist can manage it very well. But if there is frequent episodes of bleeding and the bleeding is very severe and it is not it's not stopping even doing the home remedies, then you should visit the ENT specialist. Otherwise, routine bleed like 1 or 2 episodes, slight bleeding associated with some cough, cold, or any infections can be very well managed in the ER by the GPs.
Yeah, so it can still be managed without ENT. Of course, your role is very important in complex bleedings.
Yes, yes.
But it can still be managed at home or in the ER with the help of general practitioner.
Yes, it can be managed.
Yeah. So then, what exactly is as a ENT surgeon's role is in what are the various, like suppose if a complex bleeding comes to you, what are the various treatment options
Sure.
for these patients?
Sure. So I'll just explain you the treatment options that we have for the anterior and the posterior bleed, both the bleeds. So the anterior bleed, if the patient comes to us and we see an active anteriorly bleed, so sometimes in the OPD settings only we have a chemical known as silver nitrate.
Right.
It is a cautery like chemical that we use just to cauterize the blood vessels.
Right.
If we can visualize the point where it is bleeding. Sometimes it can manage the bleeding. In case if it doesn't manage, then we do have some bioabsorbable materials. Some nasal packs are there that we put in the nose. So these packs, they are of two types. One is without any pressure. The other one is they have some balloon underneath. So without pressure when we put when there is a mild bleeding. But when we see that anterior bleed is a severe bleed not being managed by the cautery, then sometimes we put the bioabsorbable materials with the balloons in which we inflate the balloon to put the pressure on the little's area to stop the bleeding.
These are easily available most of the places?
They are available only in the hospitals usually.
Yeah, but most of the hospitals,
Yes,
these are
yes,
easily
most of the
available.
hospitals they do have. Now the second scenario comes as the posterior bleed. So I just forgot, initially when the person comes with the bleed, we have to rule out the anterior bleed or the posterior bleed, which can be done by asking the history of the patient, or which can be done by doing a quick endoscopy, like putting a small tube in the nose and just to visualize exactly from where the bleed is. Then we can make out if it is an anterior bleed or a posterior bleed. The anterior bleed management I already explained to you. If it is a posterior bleed, then the routine cautery, the putting normal bioabsorbable material, it never works. You have to go in for the balloon catheters with the bioabsorbable materials, which we have to insert in the nostril, we have to inflate the balloon, and we have to leave it there at least for 24 to 48 hours.
Okay.
And then also the posterior bleed, keeping this thing in mind that maybe after 48 hours, if the patient bleeds again, then you have to take the patient to the operation theatre, you have to put the endoscope under general anesthesia, and then you have to use the electrical cautery to clog the vessels.
Okay.
Only that works in the posterior epistaxis if it doesn't stop even after 48 hours of the nasal pack.
Okay. Okay. So then see, anterior bleeding, posterior bleeding, probably for general people may be a bit complex terms. But then what are the red flag signs which they should be looking for, which may suggest that there is an underlying problem and it may not be just a simple bleeding. It can be something like, say, tumor or a bleeding disorder or something more than that. Yeah.
So red flags, basically I should say 3 red flags are there. That first of all, if the bleed is very severe. Secondly, it is not responding to the home remedies. Third, if it is associated with dizziness, nausea or vomiting.
Okay.
So frequent episodes, heavy episodes, like if it is more than a full cup of blood which you lose, leading to giddiness, nausea, vomiting, you should consult the physician. And if you have an underlying condition like diabetes, blood pressure, vasculitis, any liver disorders which can derange the bleeding and the clotting factors, again you should consult the physician for the management.
So viewers, please understand, you need to understand certain red flags when you should be taking an opinion of expert immediately. And as Dr. Sanjay clearly mentioned, if it is associated with other symptoms like nausea, dizziness, vomiting, if it is a frequent bleeding, if it is a the quantity is quite huge, more than the smaller bleeds, that is the time you should be taking an immediate opinion from the ENT specialist. Now, Dr. Sanjay, sometimes patient who is on blood thinner or say anticoagulants and he develops this type of bleed, nosebleed, he may be having bleeding elsewhere as well. Because these are already on systemic anticoagulants or antiplatelets. So how do you manage nosebleeds in these patients who are taking anticoagulants or antiplatelets?
So these patients, again, Dr. Amitabh, most of these cases, they have a posterior bleed.
Okay.
So it's not an anterior bleed. So these patients, most of the time, they need a nasal packing with the balloon catheters just as to apply pressure for 24 to 48 hours. And then we can control bleeding in them. And in the meanwhile, we'll try to manage the derange. If there is any derangement in the bleeding and the clotting factors, that is to be taken care of. For 48 hours, the person is, we put the nasal balloon catheters and the patient, he has put on antibiotics also. And then only we can manage these kind of bleeds.
Yeah. Yeah, thank you, Dr. Sanjay. So sometimes underlying disease like say vasculitis is there or some sort of liver disease is there. So how do we identify if the bleeding is from something internal disease, systemic disease, and how do we deal with
So
that?
if the bleeding episodes are very frequent,
Mm-hmm.
then and the person, like, two things are there: either the person is already having some issues, some like blood cancer is there, some
Already
tumor is
existing
there, or
health issue.
sometimes post surgical also very common, the septal surgery which is done for the nose block, sometimes it leads to septal perforation, and these
Oh,
septal perforation again can give rise to recurrent bleeds. So until unless there is some underlying situation, the person knows that yeah, he's having blood cancer, he's having some liver issues, he is having a post surgical history. So of course in these cases we know the cause of the bleeding. But suddenly if there is I came across few of the cases in which even it was a pediatric case in which the blood cancer was diagnosed with the frequent episodes of the nosebleed.
nosebleed. So it can be an early sign for something
Yes, it
serious
can
disease,
be. Yeah, as
underlying
I
disease.
told you, if it is very frequent, if it is very heavy, if it is not responding to the home remedies, we have to take care of, we have to look for the other things like blood cancers also, especially in the pediatric age group.
Yeah, yeah. Thank you, Dr. Sanjay. So, is there any role for this nasal spray or humidifiers which we see in the home
Humidifiers,
for
of course,
prevention?
yeah, with the increased temperature, if the air is very dry, so that leads to dryness of the nasal mucosa, and that exposes more of the blood vessels to trauma, to bleed. So humidifiers, yes, they can help to
Okay,
humidify the air. Then that the air that you'll be breathing will be a bit moist, and it will provide some moisturizer to the nasal mucosa also. Decongestant spray, do we use them just to control the bleeding, or sometimes we ask the patient to put some gel in the nose. There are some inert saline gels which again helps in moisturizing the nasal mucosa.
okay, okay,
So,
okay.
or if nothing is available, even simple Vaseline. If you feel dryness, itchiness of the nose, even simple Vaseline, if you apply in the nose, it can help to moisten the nasal mucosa. Our main aim is to moisten the nasal mucosa to prevent the dryness of the nasal mucosa, so as
Right.
to avoid any bleeding from the
So
nose.
humidifier may help someone who has a dry nose
Yes,
related
it can help,
epistaxis.
but then again, you
It
cannot
has
be
its
at home
limitation.
always.
Yeah,
You
yeah.
have to go out. So
Exactly.
you
It has
have
its
to take care of the direct exposure to the sun. You should cover yourself. You should have plenty of fluids. All these
correct.
things you should be careful of.
Correct, correct. Dr. Sanjay, frequently I have heard nosebleeds, epistaxis is more common in pregnant people. Is first of all, is it a fact, and if at all, then how do you deal with that?
Yeah, of course, Dr. Amitabh, it is seen commonly in pregnancy because pregnancy causes a lot of physiological changes in the body. So there are a lot of hormonal changes, so a lot of estrogen flows in the body, and overall the blood volume increases in the body. So these situation, it prones the nasal blood vessels, they become more prone to, because estrogen, because of the estrogen, there's a lot of blood in the body, volume increases, and the nose again becomes more prone to bleed. In pregnancy, we do get, the patients, they do come that they have a frequent episodes of the bleeding, but in them, with the home remedies, it stops on its own. The other limitations in pregnancy is that we cannot start them on too much of medication. So for these kind of patients, either we ask them just to apply some nasal gel to keep the nasal mucosa moist, to have lot of fluids, and just as I told you, to pinch the nostril if there is any bleed. So these patients, once they deliver, the estrogen comes back to normal, the blood volume goes back to the normal, these episodes immediately stop.
So most of the bleeds seen in pregnancy, you mean to say they are harmless bleeding, but that should be paid attention because it's a pregnancy.
Yeah,
Yeah,
they are harmless, but it causes some irritation. For a
irritation.
layman, if you see blood, blood coming
Hmm.
out, or blood coming out
I
from the
know.
nose, blood in the hand, you become irritated, right? It is very harmless, but for a person, and then pregnancy again has a lot of issues involved with.
Correct.
Again, if there is epistaxis, so it adds one more issue to already prevailing issues. So basically, not to panic in pregnancy. If there is any bleed, just relax, don't be stressed out. Open your mouth and breathe, sit straight, pinch your nostril. Humidifier you can use, have lot of fluids. Nasal gels you can use to put the inside the nose to make the nasal mucosa moist, so as to avoid frequent episodes of bleeding.
Thank you, Dr. Sanjay. So that brings us to the last question for the podcast today. What is the one advice, or maybe one or two advices you would like to give to the people who are getting a small but frequent bleeding, when they should investigate and when they need not?
Dr. Amitabh, the basic thing is depends, if it is, as I told you, if it is very frequent and the amount is very big, causing dizziness, causing vomiting, nausea, then only you should be worried about the bleed. Otherwise, normal bleed from the nose, 1 or 2 drops, which stops on its own and which stops when you pinch the nostril, you shouldn't be worried about at all. You can start with as I told you, you can apply Vaseline in the nose, you can have lot of fluids, you can properly hydrate yourself, you can avoid exposure to sun, should be taken care of.
Thank you, Dr. Sanjay. That brings the wrap of this episode. This was a very clear, practical, and reassuring approach to epistaxis or nosebleed. Viewers, please understand, not all nosebleeds are harmful. At the same time, not all are harmless. I hope today's episode must have cleared the doubts in your mind when it is harmless and when we should be taking an opinion from the expert. If you have found any value in this episode, if this episode you found it useful, please share it with someone who gets such frequent epistaxis or who need to understand this, who is living in a dry climate or hot climate, who may get such frequent nosebleed episodes. Viewers, the purpose of this podcast is to simplify the misunderstood or complex topics with the help of experts. If you liked this episode, please hit like, subscribe. You can forward this to someone who need to understand this epistaxis, who is already a patient of frequent epistaxis episode. Thank you very much. Thank you, Dr. Sanjay, for this simple but reassuring podcast.
Thank you, Dr. Amitabh.
Yeah.